Welcome everyone to this IISS virtual forum on the politics of Indonesia's response to COVID-19. I will not dwell on the specifics of the topic. You know why you're here. You know why it is significant for everyone in the region. Why it is important for everyone in the region, in Indonesia, in Malaysia, elsewhere, to understand this issue. And I just want to say good afternoon to the nations in attendance. Also to our friends all around the world. It is 7:30 a.m. in London. Good morning, Bill. It is 6:30 p.m. in Auckland, in Wellington. Good evening. I am Shariman. I'm a fellow with the Foreign Policy and Security Studies program. With me is Dr. Juwita Muhammad. She's a fellow with the Economics, Trade and Regional Integration program of IISS Malaysia. I'm here to introduce the speaker and to assist Dr. Juwita during Q&A. Let me just very quickly read up our speaker's bio. Mr. Aaron Connelly is a research fellow leading a new program in Southeast Asian political change and foreign policy at the International Institute for Strategic Studies, IISS. Based in the Singapore office, he writes, commissions and edits research on Southeast Asian politics and foreign policy, and leads a series of roundtables and workshops on these subjects throughout the region. His own research focuses on Indonesian politics and foreign policy, conflict and politics in Myanmar, and the South China Sea disputes. He completed graduate studies at Georgetown University's School of Foreign Service and a Fulbright fellowship at Jakarta's CIISS. Aaron will speak for about 20 minutes, 30 minutes, and Juwita will moderate the Q&A for the rest of the session, which will end at about 4 p.m. Malaysian time. So we will take questions and comments principally via the Q&A window that's at the bottom of your screen, but we'll also be taking some questions by audio, comments as well by audio. So if you want to do so, please raise your hands. There is a way of doing so. Just click on the participants icon there, and you can click on raise hands, all right? So Aaron, without further ado, please take the floor, virtual floor.
Thanks, Shariman. I appreciate the invitation to address. It's really an honor to address IISS's first virtual seminar, and I always enjoy coming to IISS because I get a chance to learn from really smart IISS researchers, and then also usually I get a chance to go for nasi kandar in KL. I won't be able to do that this time, but I hope we can still benefit from the first part of that, and have a good exchange of views. I know that there are a number of people on the call with experience working in public health in Indonesia, or Indonesians who have also been following this very closely and living it day to day. And so I hope there will be an opportunity for you all to join in, and feel free to push back on any of the analysis that I'm going to put forward. I should also just mention at the outset that I'm not trying to single out Indonesia. All sorts of countries have struggled with COVID-19, whether it's my home country, the United States. I don't think I need to run through just in what ways we've struggled. If you've paid any attention to the news, you're aware. Or whether it's China with the initial cover-up in Wuhan that led to the outbreak of the pandemic, or the UK, or even here in Singapore, where there were positive reviews initially, but there was clearly a blind spot when it came to the foreign workers in dormitories here. So lots of countries have struggled with this particular outbreak. What I think is different about Indonesia is that the government, although it got a slow start, that slow start has really continued. And I think that is related to the politics of the COVID-19 epidemic in Indonesia. And so what I will try to do today is to put that in the context of Indonesian politics, so that we can better understand why it's developed in the way that it has, and where things are likely to go from here, mostly in a political sense, not in an epidemiological sense. I'm not an epidemiologist, I'm not a health professional. What I'll say is based upon reading what a number of epidemiologists and public health professionals have said about and written about Indonesia's response, but I'll primarily focus on the politics. But to give us a foundation for this discussion, it's probably helpful to go through some of the chronology of how Indonesia responded to COVID-19. Indonesia had direct flights to Wuhan It did not move to put in place travel restrictions early on, as a number of other countries did. It allowed China to restrict travel to Indonesia in certain respects, but for the most part, there were no major travel restrictions. President Jokowi, throughout the month of February, was encouraging people to continue to come visit Indonesia, even when it began to appear that people with COVID-19 symptoms were popping up in Bali, for instance. He introduced a program to pay social media influencers to encourage people to continue to come to Indonesia, when public health professionals in Indonesia were beginning to become very concerned in February about the possibility of COVID-19 spreading to Indonesia. And I think there's a number of reasons for this, but it's important at the outset to make the case that although Indonesia does not have the most confirmed cases of COVID-19 in Southeast Asia, it almost certainly has the most cases of COVID-19 in Southeast Asia. The government argues that only around 7,000, I think actually the numbers today are around 8,000 individuals have been confirmed to have COVID-19, and that there are only around 800 deaths, just a little bit less actually. But we know from the funeral data from the City of Jakarta administration from the month of March that the number of funerals in Jakarta in March were 40% more than any month since January 18, the earliest month for which we have data. And that there were about 1,300 excess deaths in Jakarta in the month of March. That's a lot, and it's certainly more than the number of deaths that have been acknowledged in Jakarta from COVID-19 at that point, which were around 99. So the number of excess deaths that we've seen is around a factor of 10 greater than the government has acknowledged. And if you look at some of the epidemiological modeling that has been done in this crisis, all of which is, these are estimates, these are models, and we don't necessarily know that it's going to be quite as bad as the models suggest. But one model from the institute in the UK that sort of Dr. Lockdown, as he's now been called, put out, argued that when you had a certain number of deaths in the community, that indicated that there were perhaps 1,000 cases in the community per death. So that would indicate that there are around 1 million of Jakarta's 11 million citizens who in March had contracted COVID-19. That seems like an extraordinarily high number. It may not actually be, that model may not really work for Indonesia, because Indonesia was singularly poorly prepared to handle an epidemic. And so the death rate in Indonesia may actually be far worse than it would be under the models that were developed in the UK. And the same researchers in the UK have now worked with University of Indonesia researchers to develop some new models for Indonesia, one of which argued that without any major social restrictions, Indonesia could expect to see around 240,000 deaths. Of course, there are now some social restrictions, but as I'll outline, they were put in place very slowly. But all of this suggests that Indonesia has one of the worst outbreaks of COVID-19 in Southeast Asia. And there are other indications of this as well. The number of doctors and healthcare workers who have passed in Indonesia now numbers officially 44. The number again is probably higher than that. And although we don't have numbers from April, so we don't know if the funerals data numbers have continued on the same trajectory that they were on in March, we see scenes that journalists have covered from Jakarta's cemeteries of dozens of individuals being buried with COVID-19 protocols every night. And so we know that the situation continues to be bad. I should just mention it briefly. Some Jokowi administration officials and some of what we call buzzers in Indonesia, social media supporters of the president, argue that this is actually due to a dengue epidemic. There is actually a problem with dengue in Jakarta, but it cannot possibly account for this increase in numbers. And this is the sort of disinformation that we consistently see from Jokowi's supporters online, who are alert to just how damaging this epidemic could be for the president, and eager to provide explanations for why it might not be the president's fault. So, why was Indonesia quite so unprepared? Healthcare was supposed to be one of President Jokowi's big accomplishments. He dramatically increased access to healthcare at the outset of his presidency. It was a big step for Indonesia through a sort of insurance-style scheme And although premiums were raised for that insurance scheme late last year, it is still a major accomplishment of the president's agenda. But what has not increased is the capacity of the healthcare system. Indonesia has 10% of the recommended number of doctors recommended by the World Health Organization. And the quality of the healthcare system has not improved either. And when you think about things like PPE, Indonesia has a shortage of PPE that is far more grave than some other countries. You see regularly photos in the media and on social media of doctors going into COVID-19 wards wearing rain jackets, repeatedly reusing the PPE that has come into contact with COVID-19 patients. So there's a shortage of PPE. There's also a shortage of ICU units. State hospitals only have around 660 ICU units. That's proportionally extraordinarily low. And then only half of them have ventilators. And you may have seen President Trump tweeted that he had a call with President Jokowi the other night and that the US has agreed to provide additional ventilators to Indonesia. Who knows if that will actually come about or not. The US also has a shortage of ventilators, but Indonesia desperately does need those ventilators. So then the next question is, why was President Jokowi slow to react? I think there's a few different ways to explain this. I'll just run through some of the possible explanations. The first is that he received bad advice early on, and the advice doesn't appear to have improved very much. President Jokowi, and I'll speak a little bit more about this later, has really surrounded himself with military men increasingly as his presidency has gone on, and security people. And when the COVID-19 epidemic broke out in Indonesia, the health minister, Terawan Agus Putranto, who is a two-star general from the Army's medical corps, was not providing particularly good advice. At one point, he said publicly that Indonesia had no coronavirus cases due to the power of prayer. At another point, he argued that jamu, I'm not sure if this is well understood in Bahasa Melayu as well, but sort of herbal remedies were protecting Indonesians from COVID-19. And he himself has a very checkered history when it comes to his own medical record. He was disciplined by the Indonesian Doctors Association last year, shortly before he was appointed health minister, for encouraging a brainwashing surgery for strokes that the association argues has no medical validity. And the Indonesian Doctors Association actually publicly encouraged President Jokowi not to appoint him health minister because they considered him unqualified, but President Jokowi went and appointed him anyways, based on what he argued was his administrative abilities, which, given the way that the pandemic has run its course in Indonesia, don't actually appear to have been particularly strong. As time has gone on, he's turned over more of the COVID-19 responsibilities in the health ministry to a deputy who also comes from the military, Ahmad Yuryanto, and is also from the military's medical corps. He, again, doesn't appear to be a particularly strong administrator when it comes to these issues. The health ministry in particular has been very slow to be able to ramp up testing. And so, we all know that one way to battle COVID-19 is to do really aggressive contact tracing and testing. Indonesia was unable to do that early on, partly because it restricted all the testing to one lab, the Litbangkes lab in Jakarta. It has now expanded testing to around 38 centers around Indonesia, but they appear to lack the reagent in many of these centers to conduct any tests. So there was a sort of statistical anomaly last week where on Monday and Tuesday, many of these centers in Sulawesi and in Surabaya were not actually reporting any new cases of COVID-19, and that seemed like it might be a good sign. It was actually because they just didn't have the reagent to be able to continue to conduct these tests. So that was another challenge, and a challenge that they're continuing to deal with. South Korea has been very helpful to Indonesia in providing some testing kits and the reagents. I know there's been a lot of focus on China's mask diplomacy, but South Korea, I think, actually deserves a lot of the credit for enabling Indonesia to be doing any of what it's doing at this point, even if it's not quite enough. As the pandemic went on, President Jokowi formed a task force that was, again, composed primarily of military men, and they're almost all men when it comes to these military leaders. The head of the task force is Tony Monardo, the head of the Disaster Management Agency. He's a former Special Forces commander, Kopassus commander. And then a number of the generals who were sort of surrounding Jokowi at the outset of his second term, they're also on this task force, including Luhut Panjaitan, who is really, although his official title is Coordinating Minister for Maritime Affairs and Investment, is really Jokowi's closest advisor and firefighter on multiple issues. And then also Prabowo Subianto, who was not initially on the task force, but met with Doni Monardo and then was added to the task force. And there may be some military politics going on there. But it's not just bad advice when it comes to President Jokowi. There was another imperative, which was Jokowi's fear that he not be seen as sort of soft or insufficiently Muslim. I know that sounds a little bit strange, but this has been the primary axis of Indonesian politics for the last 5 years, because Prabowo Subianto, when he was in opposition, repeatedly sought to energize Islamist and conservative Islamic factions in Indonesia against the president. And so the president had real concerns about, if I mandate social distancing measures, what happens to mosques? What happens to Mudik, the annual pilgrimage for Ramadan, when around 14 million to 20 million people are on the move every year? And so he waited for mass organizations like Nahdlatul Ulama with its 70 million followers, Muhammadiyah with its 30 million followers, for them to take action, although they only ever urged people not to conduct Mudik. Ironically, it was the Islamists, the Hijra preachers on Instagram, who were actually far more active in telling their followers, don't Mudik, stay home, don't go to the mosque. But Jokowi still didn't act, and he didn't employ the government apparatus to try and prevent the annual Ramadan pilgrimage. And as advisory measures for social distancing came into play in Indonesia, a number of people undertook Mudik early and on their own. And so a number of these people who had the virus in Jakarta in March had already left for their home villages. So they'd already, pulang kampung. And so they took the virus with them into parts of Java and the rest of Indonesia that don't have the same healthcare capacity that Jakarta, for instance, does, limited as it is. So that's another challenge. Finally, last week, Jokowi came out and banned Mudik, although the restrictions only came into place a few days later on Friday last week, and sanctions won't be issued until next week. So it's almost an invitation to get out while you still can for those who are planning to make Mudik. And all the government says that they conducted a survey in which only 7% of people have gone back to their home villages at this point. We think it's far larger. I've been told by someone with access to private telco data that as early as late March, one of the main telco providers believed that 30% of people had already left Jakarta. A lot of low-wage workers who would normally be coming into Jakarta weren't coming into Jakarta anymore. They were staying in the exurbs of Jakarta and West Java and Banten, and now a number of them have left early. But even if it is only 7% that have left, that's still a lot of people with the virus going to communities. So the administration has been sort of spectacularly late. And if you think about Chinese New Year and the Spring Festival as being one mass migration that did quite a bit to spread the virus, it may be that Mudik and Eid al-Fitr and the Jokowi administration's late reaction, we may be looking at a situation in which a month from now, we're talking about Mudik as the second big annual migration to spread the virus. And that was foreseeable. A number of public health experts and civil society activists were encouraging the Jokowi administration to put these restrictions in place as early as the first couple weeks of March, and the administration didn't do it. They delayed repeatedly. And even now, the messaging on this has been a little bit unclear. Last week, Jokowi did an interview with Najwa Shihab, who's a television presenter who has traditionally been very sympathetic to Jokowi, fair, tough sometimes, but as the interviewer that Jokowi most prefers to be interviewed by. And he was very unclear. He said, well, we banned Mudik, but we didn't, that's not to say people can't pulang kampung. They can't, that they can't go home to their home villages. So the messaging on this is still very, very strange. Let me just offer a few reasons that it might not be as bad as the epidemiologists and the public health experts and Jokowi's critics are saying. One is, you may have seen, there's this argument that the virus does more poorly in hot weather. There's evidence for and against that thesis. Certainly it didn't help migrant workers in close quarters in Singapore. There's another argument that countries where the population receives the BCG vaccine for tuberculosis receive almost accidentally a form of limited protection against COVID-19. Indonesians tend to receive the BCG vaccine at birth, so that may provide some protection. This is another, many people have made this argument regarding India. The reason India hasn't seen a more serious outbreak is related to the BCG vaccine. Although I'm told that in the UK, the BCG vaccine was issued until around 2005. So that may be an argument against that theory. And then there's this latest theory, which is that the strain in Southeast Asia is a less severe strain of the virus, and that there are multiple mutations in the virus already, and that Southeast Asia just hasn't seen the most severe strain yet. But if indeed the epidemiologists are right, we need to start thinking now about the economic and political consequences, what this would mean for Indonesia. If indeed 240,000 Indonesians are going to die from the virus, or some number on that scale, we're talking about a number of deaths that is on par with the number that died in the anti-communist pogroms in Indonesia in 1965. And economically, if restrictions are put in place, or if there is a large-scale number of deaths in Indonesia, as some are arguing there will be, we're talking about an economic collapse that could be on the scale of 1998, when the Indonesian economy contracted by 13.5%. And the rupiah went from somewhere in the 2,000 range to the 13,000 range. Those would be big economic, social shifts, but they would also be big political shifts. Remember, in 1965 and 1998, we didn't just get a change of government in Indonesia, we got a change in the system of government. And so the threat to Jokowi's administration from the virus, from his inaction, but also potentially from actions that he might take in the future to deal with the virus, could be extraordinary. And we should be thinking about possibilities that are a little bit outside the box right now. Just to give you one example of how this specifically could work its way through the political system in ways that are contrary to Jokowi's interests. President Jokowi has really used the state-owned enterprises to push through patronage in ways that keep his coalition together. You can debate about how appropriate that is, but that's one way that he has been able to create some political stability and also a consistent level of economic growth. If he's unable to do that because Indonesia has to take on a considerable amount of debt and put considerable funds toward the alleviation of the virus or to the recovery from social distancing measures, that's going to damage his ability to keep his coalition together. And I think it's important to mention here, the Indonesian political system is very different from any other political system. It doesn't easily match on to a Westminster system, although we sometimes refer to the legislature as parliament. It doesn't easily match on to an American or French presidential system. The legislature and the president are really partners in crafting legislation, but in such a way that almost every piece of legislation requires a really broad consensus, approval from all of the parties. So Jokowi's second term agenda that he outlined 6 months ago when he was first inaugurated, which included moving the capital to Borneo, to East Kalimantan, and it included these two really big liberalization bills, omnibus bills as they're called, that would reform labor safeguards in Indonesia. Those are going to be very difficult for Jokowi to do, both because he might not have the money to be able to fund, say, something like the move to the new capital, and because he might not be able to push patronage through the system in ways that secure political support for something like the omnibus bill, to which there had already been a sort of incipient opposition before COVID-19, led by labor unions and students and small groups of liberals. So another possible path for Jokowi to deal with the epidemic and any incipient opposition is to become more authoritarian. And I should just add a disclaimer here, which is I'm going to speak a little bit about some of the restrictions on civil liberties that have been introduced in Indonesia over the last few years. And I'm not doing this as a critic. I'm not doing this as, say, a human rights activist. That's just not our role at IISS. But I'm doing this to provide context for the political situation in Indonesia, because I think it tends to be poorly understood outside of Indonesia how things have changed under Jokowi in terms of the civil liberties that are available to people to express opposition to the government. And this has emerged in a particularly salient way over the last 6 days, 5 days, with the hacking of a WhatsApp account of one of the government's critics, Rabia Patra, and then the use of his WhatsApp account to send incendiary messages encouraging people to loot on April 30th, on the eve of May Day, and then his arrest for sending those messages, even though it was very clear that he didn't send those messages. So in other words, this activist, who had been very critical of the Jokowi administration's response to COVID-19, was effectively framed for incitement to riot. And this is something that had been happening to opposition activists repeatedly over the last few years, but it tended to be sort of more fringe figures of the opposition. It was people like Rizik Shihab, the leader of the Front Pembela Islam. It was people like Aryo Joyo Harikusmo, who was the nephew of Prabowo. It tended to be sort of people outside the mainstream. It didn't tend to be liberal activists. What's different now is that it appears that people who were involved in liberal politics in Indonesia and who have been critics of the administration are now being targeted with these sorts of measures. And so the move toward a more illiberal form of democracy in Indonesia under Jokowi over the last few years, it's been very slow. It's been almost imperceptible, but that may accelerate as a result of what's going on with the COVID-19 epidemic in Indonesia. And the fact that the task force that Jokowi has formed is dominated by military men, and the fact that the police are using defamation laws to prosecute dozens of the administration's critics, ostensibly for fake news, one of them actually for defamation of the president, which is not supposed to be an operative law in Indonesia anymore. That is an indication of where Indonesia is moving more broadly over the long term, but where it may begin to move much more quickly as a result of COVID-19 and the pandemic. Just one last note on the politics, and then I'm very eager to get back over to you all and to have a sort of dialogue with everyone as much as we can using this technology. I just mentioned there were sort of contrasting examples to the central government with regard to how to handle COVID-19 from two governors. One of them, Anies Baswedan, the governor of Jakarta, and then one of them, Ridwan Kamil, the governor of West Java, who may be opponents in 2024 in the presidential election. Jokowi is currently term limited. He can't run again in 2024, although he's almost certainly looking for someone who will protect his legacy. Anies Baswedan was very early in encouraging social distancing measures and very frustrated with the government's reluctance to impose social distancing measures, because while he is the governor of Jakarta, Jakarta as a metropolis is actually much bigger than his jurisdiction. It includes many smaller municipalities in West Java and in Banten. And Anies was early. He appeared to be guided by the science, and he was very critical of the administration. It was him who first mentioned that the funerals data disproved what the government was saying about the number of cases of COVID-19 in Jakarta. And I know Johannes Sulaiman is on the call, and Yo has argued that one of the reasons that the Jokowi administration was so slow to respond is because Anies was fast, and they didn't want to appear to have been pressured by Anies. That they believed that Anies was making this political, and as a result, they sort of responded slowly. But I think in retrospect, Anies is going to look much better when it comes to handling COVID-19 than Jokowi will in 2024. The other governor who responded more quickly was Ridwan Kamil, who is seen as more closely aligned with Jokowi's politics than Anies is. He's a former architect and a former mayor of Bandung. And he was also much more responded to the virus much more quickly, although he was more reluctant to criticize the Jokowi administration. And I think some of the president's supporters who are unhappy with how he has handled this might look to Ridwan Kamil and say, he handled it much better, but he did it without being political. And that might attract quite a bit of support as well. So everyone is already thinking about 2024 and what comes after Jokowi. But I think the virus is likely to sort of dramatically reshuffle the politics in the lead up to 2024 and how Indonesian politics operates. There's plenty more to say about the politics, about the epidemiology, and I'm eager to hear from you all. And hopefully, we can get into some of that in the discussion in Q&A.
Thank you very much, Aaron. That was fantastic. Before we go to the questions, perhaps you mentioned Johannes there. If you're right, we'll just ask Johannes to make a couple of comments before we move on to the Q&A. Right, I'll just unmute Johannes here. Let's go. All right, Johannes, you're online.
Okay. Okay, can you hear me? Because, I mean, sorry, I don't want to admit it, but this is actually my first time using Zoom. So basically,
very clear,
okay.
Very clear, Johannes. By the way, everyone, Johannes is with the Universitas General Ahmad Yani. Yeah. All right. Go ahead.
Correct. Yeah. I guess I don't really have any disagreement with what Aaron said, but maybe just an additional comment, basically, on what he said about like the authoritarian turn of Joko Widodo, which I kind of agree to some degree that yes, I mean he's right that the police has been behaving kind of ham-fistedly with the arrest of a critic of Jokowi under a very, very dubious excuse. I mean, the guy was phone was hijacked by somebody, and then it was used to spread lots of crazy things like, oh, we are going to have a riot in May. And why don't we just overthrow everything and whatever? And and the police just said, hey, we are going to arrest you for that. So I mean, so it is kind of very, very flimsy evidence, but I think I want to put it in context. I think the entire authoritarian turn itself started like back in 2017, after the Jakarta gubernatorial election, where the government is basically look at the Islamist rise to power and basically Anies Baswedan rise to power by using ethno-religious conflict and black campaigns and all those hate speech and whatever, and basically government argue that look, we cannot win against hoaxes except if we are going to use them we are going to use military ways, which is like arrest them, just strike them when they are hitting it. So that's one of the main reasons why lately there has been lots and lots of use of the draconian anti-speech law. I mean, which is actually based on the old law signed by Yudhoyono back in 2012 that regulate speech on the internet on the websites. So I think I agree that it is a problem, but to so I guess that's what I really want to add here to what Aaron said basically, just put it in the context of this authoritarian turn. Basically, the argument is if we don't use authoritarian ways to deal with the Islamists, with the hoaxes, then the democracy is screwed. So, in order to defend democracy, then we have to go to take authoritarian tools, which is kind of counterintuitive. But at the same time, I mean, lots of people actually, interestingly, lots of Democrats actually start to agree that in order to save free speech and democracy, we need to limit free speech. Well, I guess that's what I want to say. Thank you.
Yes, Aaron. Before you address Johannes' points, maybe you can take some questions, and Juita will take the lead from here.
Yes, we have our in-house Indonesian expert Muhammad Sinatra with a question on Jokowi's presidency. Some regional leaders have appeared to take more initiatives than the central government, it seems. So in your opinion, how will this affect their popularity level, especially vis-a-vis President Jokowi's as well as the central-regional relationship? So that's the first question.
Yeah, I think that was the point I was making about, I'm not sure when the question came in, but that was the point I was making about Ridwan Kamil and Anies Baswedan, where, some have argued that Indonesia's decentralization has actually saved it from a much worse outcome in terms of the pandemic. But Indonesia's regional leaders, elected regional leaders, are still restricted in what they can do by the government. So, for instance, after Jokowi issued a new regulation in lieu of law that allowed what are known as large-scale social distancing measures in Indonesia, PSBB, Anies requested from the health ministry permission to implement them almost right away. There was a long sort of bureaucratic process to go through to get permission from the health ministry. And for days, the health ministry wouldn't give him permission to implement these measures. And Minister Terawan and others were very sort of evasive when asked why Jakarta was not yet being given permission to implement these measures, and really forced Anies to go public and be even more critical of the administration than he had already been. So the central government really is needed at a time like this to step in and try to coordinate some of these actions. It seems very reluctant to do that. Luhut Panjaitan at one point said, we're not going to ban mudik before they had, because people are going to do it anyways. And the ban on travel for mudik now already appears to be very porous, not just chronologically, but also in terms of giving authority to individual governors and regents to determine the conditions of how it can be enforced. And so, although it appears to be enforced much more strictly in Jakarta than in other provinces, the police are saying, even the Jalan Tikus is sort of the alleyways are being patrolled by police. I think that's probably not true, but in central Java, where Ganjar Pranowo is taking a much more proactive line, there's only, I think, 8 interprovincial roadblocks that are being set up. So it's still pretty porous. And a strong central government could step in here. Luhut is currently also the acting transportation minister. Could step in here and put in much more stringent controls, but it's not doing that. And again, it's just sort of a piece with this slow response from the Jokowi administration. So in some ways, decentralization really has helped Indonesia to protect individual municipalities from a much greater blow from COVID-19. But in other ways, the central government really does need to step up and begin to coordinate some of these actions, and it's not doing that.
Okay, thank you. Speaking of Jalan Tikus, this is just a follow-up question on Indonesia and Malaysia's relations. So how will you think Indonesia and Malaysia relations be affected if there was a prolonged and blanket prohibition of Indonesians getting into Malaysia? Indeed, if measures of rough enforcement were taken at porous borders, as was mentioned before, and this was put forward by Tan Sri Datuk Dr. Muhammad Munir Abdul Majid. That's the question from him.
Juwita, if I may sort of add on to that, Aaron, just convening this virtual forum, we were actually quite sort of anxious in the beginning. So it's like, what is this Malaysian organization doing this? So there's that sensitivity there as well. Which is why that question from Tan Sri Munir is very apt, because that's the underlying thing. In Malaysia, there was this doctor, very prominent doctor, who said, Indonesia is a time bomb and all that. And I think that upset quite a lot of people on the Indonesian side and all that. So there's all that dynamic going on. It's just not just the movement of people and the travel bans and all that. It's also this sort of like the usual dynamic between Malaysia and Indonesia going on. If I could add to Tan Sri Munir's question. Thank you.
I have to be perfectly honest, I'm not sure I'm the best person to answer Tan Sri's question, just because I'm not a Malaysia specialist. And so I'm not quite so comfortable anticipating what the effects might be for Malaysia. But I think, what you said, Ray, applies more broadly, is that there is this real reluctance within Southeast Asia. To back up a little bit, I can say 2 things. I think there's a reluctance in Southeast Asia more broadly to comment on each other's politics. You don't see many events on Indonesian politics in Malaysia, despite the proximity and connections and the cultural connections. And yet, it's really important to Malaysia, given the migration between the two. Here in Singapore, we do have quite a few events and institutions that hold events on other parts of Southeast Asia, and that's not always appreciated, right? So I think it's great that ISIS is taking a look at what's going on in Indonesia because it's your close neighbor. I suppose I'm in a sort of unusual position in that I'm not Southeast Asian, and so sometimes perhaps I can say things that others might be more reluctant to say about neighbors. But I've noticed just globally, criticism of individual countries' response is being met with a kind of nationalism on social media and in the media and from government officials that I hadn't really seen before. So I'm often comment on Indonesian politics, and I think a lot of Indonesians are used to it by now. My comments sometimes get reported in the press. The level of abuse that I've been getting for saying, why are you commenting on our politics? Look at Trump, which is a perfectly valid response. But I think there's a sort of nationalism that has cropped up in Southeast Asia saying, take care of yourself, don't look at us. But because Southeast Asia is so interconnected at this point, even despite what's happening with the shutdown and in border connections and things like that, it is actually really important for countries in Southeast Asia to be looking at each other and examining, what's going wrong in other countries, but also what's going right and what we can learn from other countries' response. President Jokowi actually often likes to compare Indonesia to Vietnam. Last year during the trade dispute between the US and China, when a lot of factories were moving from China to Vietnam, he was asking his ministers publicly, why aren't they moving to Indonesia? And this was really one of the sources of the omnibus bill that's going before Parliament. I think, a lot of us could be looking in Singapore and Indonesia and Malaysia at Vietnam and how successful they've been in fighting COVID-19. So it's not just a negative comparison, but there can also be positive comparison as well. But I didn't know if Juwita or Shariman, you wanted to answer Tan Sri's question about some of the consequences for Malaysia, because you might be better placed to do that.
No, mate. Yeah. But we'll move on to the next one if we could. Sorry, Dr. Juwita.
Okay. Is there anyone who would like to raise their hands to ask Aaron directly via their microphones instead of the questions that we've received here? Anyone? So in the meantime, I have two top-rated questions on ASEAN. So I'll throw you the first question. So Pak Guntur asked, how do you see the regional cooperations under ASEAN in handling the COVID-19 impacts, both in health and also in the economic sector? Do you think that ASEAN member states, including Indonesia, have failed to utilize the power of regionalism on this matter or otherwise?
Yeah, it's a great question. And it's interesting to note that Marty Natalegawa, former Indonesian foreign minister, wrote an op-ed in the Bangkok Post pretty early on in the pandemic, I think in early February, asking, saying, ASEAN has been working on pandemic preparedness for 10 years, since SARS, since, I guess longer than that, actually, I think. Why isn't ASEAN doing more when it comes to COVID-19? What were all these meetings that we were having, these intersessionals, and what were they for if when we finally have a pandemic, these things aren't being put into practice? And I think slowly we begin to see ASEAN doing more on this. You would have seen the special summit that was called 2 weeks ago by Vietnam. And of course, there was also a meeting in Vientiane before things got really bad. It was almost a way of ASEAN showing solidarity with China in February. There was also a call between Mike Pompeo and ASEAN foreign ministers last week. I'm not sure how productive that call actually was, but you begin to see some of the international response moving through ASEAN. And I should mention the +3 countries as well. And some arguing that the +3 formula is actually the best way to respond to this because it's the East Asian countries that are the Northeast Asian countries that appear to be most capable. And whether it's Korea with the testing or Japan with its social distancing measures or China with its lockdown measures, and that very similar to the way that ASEAN responded in 1998, it might actually be ASEAN +3 that is the effective formula for response this time around. I think the other East Asia Summit countries would be very upset with if that formula actually does become the primary permutation that's used to respond to the crisis in cooperation with outside countries. But it does seem as though ASEAN could have been doing more and more quickly, and I'm not sure where the Secretariat was on this. And perhaps that's when we do this sort of fact-finding after action report, it'll be interesting to see if that's something that's raised.
Okay, thank you, Aaron. We have a hand raised by Tan Sri Munir. So let's go ahead, sir. The floor is yours.
Thank you very much. If you can hear me, I mean, it is good that the question was asked by ASEAN, because I think the general view is that President Jokowi has been quite disappointing in terms of his involvement in ASEAN. It was expected that after his first term, his second term would result in a greater activism in ASEAN. Now, against the backdrop of the domestic political events that would happen, Aaron, that you described, it doesn't seem that there's any likelihood of a greater active interest in ASEAN in Jokowi's second term. And I worry if the events that you foresee did occur, however closely they can be compared with what happened in 97, 98, and indeed in terms of numbers of fatalities with 1965, if those events were to occur, I mean, how much time would he give to ASEAN? Number one. Number two, I'm thinking of August, August, and thinking of the smog, the so-called haze. If that were to occur again, what would happen with domestic politics being such a strong pull on his time? So I know we might be in for not just economic recovery among ASEAN countries, but also, sort of tension that may arise with the smog that I think may come or will come. Thank you.
Those are really excellent points, and I've also been thinking about the smog just on a personal level. I'm wondering if supply chains will continue to be working to produce air cleansers and things like that, and so I was trying to get online and order one before supply chains potentially shut down. But I think more broadly, I mean, what you've said is exactly right, that Jokowi is going to be more inward-looking in his second term. That was already the case before the pandemic, but it's going to be even more the case now as a result of the pandemic. I mean, keep in mind, his priorities for his second term were to move the capital to Kalimantan, and that was going to be the exchange rate changed now, so it's now a $30 billion US project. And then also this omnibus bill to attract more manufacturing to Indonesia, which is a very inward-looking strategy anyways, and it's going to be, I think, even more inward-looking as a result of this. And I don't know that there's anything that other countries can do, much as Australia might want to, or other ASEAN countries might want to sort of snap Indonesia out of that more inward-looking spell. This is just going to be a 10-year period of Jokowi's presidency in which Indonesia is much more inward-looking. And I think if you go back, the first person to really identify this was Eve Warburton in a journal article, I think back in 2016. She called it Jokowi's new developmentalism. It's not really developmentalism in terms of looking at things like child stunting or maternal mortality rates, things like that. It's developmentalism in terms of how many airports can I build, how many toll roads can I build. Jokowi views himself as a builder, and that remains his primary goal. And that doesn't really involve a lot in terms of foreign relations, except in terms of attracting investment, and from countries like China, and then getting Japan to try to compete to stay up with China. And so that's not something that ASEAN is really able to help Jokowi with, and it's one of the reasons he's not been particularly interested in working with ASEAN.
Right. Okay, thank you. We have another ASEAN-related question, and this is probably a good time to answer it so that it could be built upon what you've answered before on ASEAN's role in mitigating the outbreak. There is just an additional question by Mr. Arif Abdullah on transboundary movement. So what is your take on transboundary movement regulations post-outbreak? Do you foresee that until we see that there is a development in vaccine, many countries will want to tighten their preventive measures and hence can be more protectionist in terms of tightening their borders. So what is your take on that?
Yeah, well, again, I'm not an epidemiologist, and I'm not sure I'm the right person to be responding to that, but I do think I've read similar things as well. And I think if that is the case, then Indonesia will probably be cut off from the rest of the world for longer than other countries, just because you think about the size of Indonesia, and if, I know the Dutch had raised the possibility of sort of plague passports where you have to be tested as negative in order to travel, things like that. There's some saying that WHO, I think, said last week that won't work. But the restrictions that are in place, I think, may end up being in place on places like Indonesia for much longer than places like Singapore or Malaysia or Vietnam. And, if we think about how that's going to hold Indonesia back, a country that relies on, say, tourism, what will that do to Bali's economy? Bali actually recovered pretty quickly from the bombings in 2003, but it might actually be much longer before Bali is able to recover from the virus. And so I think we're looking at a sort of a different kind of economy for Indonesia because it may be much further behind other countries when it comes to eradicating the virus or getting the vaccine out to its population, things like that.
Right, okay. Do we have any more raised hands?
Hi, Juita. Yes, we have Dr. Bridget Welsh.
Okay, go ahead.
Fair enough. Excellent presentation. I have two sets of queries for you. I wanted to use whether or not you could expand further on the economic effects of the crisis and how you see them playing out politically. One narrative has been that by delaying the response, he's been protecting jobs of ordinary people. Do you think that this narrative has resonance? And also in the economic side, Indonesia has been able to secure loans quite early on. Do you think this will have an ameliorating effect on the backlash? So on the political side, I was curious if you could speak about whether or not this crisis is shifting the fault lines away from the nationalist Islamist fault line, the conservative liberal one, to a different sort of thing, looking at more competency in government. And in fact, we're maybe seeing not necessarily contenders for the presidency or changing the national things, but a real shift in the way people are thinking about their politics and their politicians in Indonesia.
Those are really great questions. Thanks, Bridget, for tuning in. I think when it comes to the delay, it depends upon the course of the virus. If it turns out that the virus is not nearly as bad in Indonesia as public health experts and epidemiologists were telling the government that it was going to be in March, then Jokowi, perhaps accidentally, perhaps through, not by virtue of a particularly thoughtful response, he may have done the right thing by delaying the economic, by delaying lockdown measures, so the PSBB, large-scale social distancing measures, by delaying the ban on mudik. But if he's wrong, it's going to be an extraordinarily costly error. I think, a toll greater than any of us have actually lived through or can imagine. And so that would have been an extraordinary gamble, because if the plague, the epidemic does take the number of people that the UI researchers forecasted back in, I think, 2-3 weeks ago now, then that will have an impact on the economy. And just more broadly, we were speaking in the last question, the restrictions on movement that will affect people going to Indonesia, that's also going to have an impact on the economy. Jokowi had this plan to create 10 new Balis, and I think that that's probably off the table now. And so some of these plans are going to affect the economy anyways. In terms of the loans, I was a little bit surprised when towards the beginning of the pandemic, Indonesia was able to issue a number of bonds. And I asked a number of people in finance about those bonds. And what I was told was basically a lot of this was in training before the pandemic, that a lot of these people who, sort of the bond brokers and people who buy these things, they don't look actually that closely at the fundamentals of the country. They don't really have the capacity or the time to do that. But I think a lot of that is now slowed down, and it might not be possible for Indonesia to raise as much debt on those terms as it did in March. I am not a finance expert either, in addition to not being an epidemiologist. So I've had to rely on people who are, and they're very skeptical that Indonesia is going to be able to continue to raise debt at those rates. The good news is Indonesia is not actually a very indebted country. Since the Asian financial crisis, it's managed with debt loads of 3% of GDP. That was actually a legal requirement that they have just for this crisis. Sri Mulyani, the finance minister, has broken through, which I think was probably the right thing to do. But it doesn't seem likely that Indonesia will be able to raise the kind of money it needs to provide, say, income support in the way that Singapore is doing, or the US or the UK. And so a lot of people who are in the gig economy who have gone home from moving, they're going to be hit very hard by this because the government doesn't have the funds to be able to get money to them at the levels that it might need for a sustained period of time. It does have a history of doing short-term programs like this through the Bantuan Langsung Tunai, the direct cash aid program that started in 2005. But those programs are actually relatively small compared to what we're talking about now. On the question in terms of new fault lines, I think it's really interesting. If you look, Max Lane at IISS actually had an interesting essay that came out last week that basically argued that now that Prabowo is in the cabinet, the fault lines have completely shifted, and that political Islam is something of a spent force, and that really it's the conservatives in the government, and then sort of tempo journalists and activists from labor and students, and this small group of liberals, sort of the Ravi Patras of the world. I'm a little bit skeptical of that analysis. I actually think that the number of liberals and tempo journalists and unions workers they're probably still too small to do anything other than prevent some of these omnibus bills from going through, but it wouldn't be a full realignment. But in terms of competency, maybe. If you look at 2024, if you had a race between, say, Ridwan Kamil and Anies Baswedan, you could make an argument that would be a race that built up in that way, because these were two really competent managers of this public health crisis. And on the other hand, if you have some individuals from Jokowi's side of politics who are less competent to contest that election, you can make an argument that it would be sort of a determination of what Indonesians value in terms of competence versus identity politics. But I think it's too soon to say one way or the other just yet.
Okay, let me read out two questions on Indonesia. Number one, do you think the military cooperation in Indonesia is sufficient to help the government curb the spread of COVID-19? And the other question is by Ms. Fabi Oldfisra on the income support that you mentioned just now. Due to the lockdown and the ban to mudik balik kampung, the social assistance program is not very well in reaching all parts of the population, since there is now a lot of those unemployed and contributing to the new poor families, the numbers to the new poor families. What is your suggestion to this condition in income distribution or income support distribution? Yeah.
Well, yeah, again, I mean, it's very challenging for Indonesia to provide the kind of income support that other countries have provided. And there are even questions, whether or not it's sustainable in the United States or the UK for these developed countries to be able to provide this kind of income support. And in Singapore, there's some question about that as well, although because we don't know the amount of the reserves here, it's difficult to say. And so if this is sort of a short pandemic, then using models like the BLT, the direct cash aid program, would actually be a really effective way of ameliorating the poverty that the lockdown measures would create. On the other hand, if it's a much longer term problem, then you need a structural solution, and that wouldn't be just direct cash aid. But we haven't seen the government really be very aggressive in terms of either talking about structural change or with direct cash aid. So I'm not sure which direction the government's going to go in here. It has limited options, but it doesn't appear to be exploring those limited options very aggressively one way or the other. And I'm sorry, I think I forgot a second question there.
No, the first question is on the military cooperation in Indonesia, whether it's sufficient in helping the government to curb the spread of the coronavirus.
I guess I would just provide the context here, which is that Indonesia under Jokowi, the military has come to play a much more active role than it did under SBY. And that's kind of counterintuitive. You would have thought that SBY, a 3-star general, 4-star general, would have brought the military back into politics in a much more assertive way. But actually, SBY was very signed up to some of the norms of reformasi, and he managed the military's slow, arguably too slow departure from politics. And he could do that because he came from the institution, and he surrounded himself with fellow classmates from the Abri Academy who he knew he could trust, and he removed people who he thought were too ambitious or too aggressive. And Jokowi didn't have those kind of connections, and when he came into office, there was immediately a crisis because he tried to remove the national police chief and install Megawati's former aide-de-camp as the police chief at her request. And in doing so, set off a really fierce struggle between the police and the military, because the Corruption Eradication Commission, which was seen as more aligned with the military, immediately named him a suspect in a corruption case. The police then named all the Corruption Eradication Commissioners suspects in unrelated cases. And the military, because it was close to the KPK, became Jokowi's kind of backup in his early fights with the police. He now has pretty good control of the police. As of 2016, when he named Tito Karnavian National Police Chief, Pak Tito is a very close political ally of Jokowi now as well. He's now, of course, Home Affairs Minister, but still very much a person of influence within the police force. And he also now has pretty good control of the military. There were some doubts last year about his just how completely he controlled Kopassus, the special forces. But he's installed Hadi Cahyanto as Panglima, as Commander-in-Chief. Hadi was commander of the air base at Solo when Jokowi was mayor. They're very close. Andika Perkasa is head of the army now. Andika was the head of Jokowi's bodyguard unit when he was first inaugurated as president. So he's become to rely on the security forces in a much greater way than SBY did. But in exchange, they've taken a much more active policy role. And that policy role hasn't always been helpful to good governance. The military's culture, although there are exceptions within the military, and although Tito, there are exceptions within the military and within the police force, but in general, this is not a culture that values transparency. It's not a culture that values receiving advice from people who have degrees in public administration. And it is a culture that values swift action, very visible action. And that has not been the kind of culture that has been needed for this particular crisis. And so I would argue that actually the military's involvement in this event has not been particularly good for Jokowi, for the public, for the crisis, or even really for the military, because it hasn't put the military in the best light either. And the best role for the military would be to remove itself from some of these crises and to focus on what under SBY it outlined as its long-term ambition, which is to provide a minimum essential force, an MEF, to defend the country by 2024, which is a goal that it is not on track to meet.
Okay.
So, sorry, Dr. Juwita, Dr. Hu had a question about the military. I'm just wondering, Dr. Hu, did Aaron answer your question? Would you like to ask a follow-up, perhaps?
Oh yes, yeah. I think Aaron has already answered the extent of the militarization of Indonesia's politics and also the dynamics between the political and military elites very well. Thank you very much. So maybe just one more follow-up question. Do you think the military would push on the agenda to move their new capital despite the COVID-19 situation?
Yeah, it's interesting. Initially, Pak Luhut said that everything was on track, and that the new capital, that they were already, surveying sites, and this was back in March when things were already quite bad in Jakarta. And at this point, the government has now said, look, the planning's on hold. We're focused entirely on COVID-19. I don't know that Jokowi is going to be willing to give this up entirely. But the two factors that are going to make it very difficult is, we don't know how long this epidemic will last, and it may just not be possible to begin something like a massive construction project in one place, and then the financing. And so there was always some skepticism that Indonesia would actually be able to secure the financing for the new capital. Again, this was, depending on when you plot the exchange rate at, I think it's now a $30 billion US project. But there were entreaties to Masayoshi Son. Tony Blair joined the commission in order to help attract some financing and provide advice, although it's not clear what advice he was providing. And so there were all sorts of efforts to attract financing for this project, but it wasn't always clear where it was going to come from. Some speculation that a lot of it would have come from China ultimately, with JBIC kind of playing a catch-up role. So I think that's probably off the table at this point, but this is what Jokowi wanted his legacy to be. And so whether the president is willing to give it up or not, I don't know. And it's not impossible to imagine President Jokowi in the Astana and Bogor, looking at models of what could have been his new capital in Kalimantan towards the end of his presidency. But whether or not it actually ever comes to fruition or not, it's very, very difficult to see it happening.
Right. We have a question from our very own Dato' Steve Wong. He writes, compare Indonesia's response with that of India's. The latter is even more populous, impoverished, and fractious. So does this mean that Modi's job is easier than Pak Jokowi's at this point in time?
To be perfectly honest with you, I don't know enough about the Indian response to really be able to compare the two. I've spoken to some of my colleagues at other organizations in India about the response, and one of the things that they raised early on was that they thought the BCG vaccine might be providing some immunity in India and might help to explain why India hasn't seen an outbreak on the scale that people expected. But beyond that, I'm not really sure I'm well positioned to comment on India. Dr. Steve, I think maybe you'd be the better person to comment on that.
Maybe we can come back to that question again if anyone else has any comments on that later on. Here we have a question from Ms. Elina Noor, all the way from Hawaii. So how has the Jokowi administration's handling of the COVID-19 impacted the Indonesians' perception of and trust in their own government? Is the government seen as the primary lead that people can turn to for guidance and assistance, or have the Indonesians have they preferred to rely on religious organizations like the NU, the Muhammadiyah, and the other CSOs during this pandemic?
Well, the first thing to say is that the Muslim mass organizations, the DACA organizations, they play a huge role in terms of provision of social services and anyways, on a normal basis in Indonesia, and that's even more the case during the pandemic. They were early in urging people not to make mudik. They ultimately didn't issue fatwas, although the Majelis Ulama Indonesia, the Clerics Council, did, banning mudik. But when you talk about trust in government, it depends upon the particular institution. And so the Corruption Eradication Commission used to have very high trust in government. It no longer does. The military actually is one of the organizations that has the highest levels of trust in government, followed somewhat distantly by the police. And then other organizations and central government organizations, there's a lot less trust in government. I've actually been a little bit mystified by the lack of really good polling. We had one poll in early March that indicated that about 70% of Indonesians approved of Jokowi's response, but again, that was in early March. There's been another poll by Gallup recently, although I haven't looked into the methodology. Gallup's not an organization that normally frequently polls, so I'm not sure if they had an Indonesian partner who helped them with that. I'm not sure how credible it was, but it indicated, again, strong levels of support for the Jokowi administration's response. I don't know if that's sustainable if we look at some of the forecasts for economic growth or where the epidemiologists say the virus might go. So there may be a collapse in support for the as time goes on. But I think it's telling that there's not been that many polls by Indonesian organizations.
Aaron, I think we're losing you. We can't hear your voice.
Can you hear me now?
Yes.
Okay.
Yes. Loud and clear now.
I was just going to say, oftentimes when there's not a lot of polling in Indonesia, it's occasionally because the polling is embarrassing to the government. A number of key polling organizations are very closely aligned with the administration and have been known to withhold polls when those polls provide numbers that are not flattering to the government. So I've not seen any of the really big pollsters release polls in the last 2 months. And that may be because the numbers are not impressive, but it's difficult to say at this point.
Right. Okay. Is there anyone who would like to raise their hands to ask the questions directly to Aaron? I don't see any hands raised as of now. I do have a question on Indonesians working abroad. So this is from Ivan To. As Indonesia sends millions of Indonesians to work abroad, so it's about 10 million workers working in Singapore, Malaysia, and Hong Kong. How will it affect Indonesia as a whole, particularly on the family that rely on them earning abroad? If the lockdown and the traveling is still not allowed for the coming months, approximately Indonesian rupiah of 120 trillion is going to be lost from remittances. So what is your take on this issue, Aaron?
Yeah, no, it's a great question. And I think here it's worth giving full credit to Kemlu, to the Foreign Ministry, which has been doing a really extraordinary job under actually quite dangerous circumstances, depending on the countries, in looking after Indonesian overseas workers. Whether they're in New York, where I know people at the consulate in New York have been going out to New Jersey or to the Bronx every day to make sure that Indonesians are okay and that they have food and that they have what they need, or in Singapore. And so, I mean, this is, if you're looking for sort of heroes in all of this, an organization in Indonesia that's really stepped up, done its job in a quiet way, but done it very well, it has to be Kemlu. And I know that friends at Kemlu are operating under a lot of stress right now, but what they're doing is really pretty heroic. I would say at a more macro scale, Indonesia does have a lot of overseas foreign workers, but their remittances don't form as much a part of the economy as, say, the Philippines, where it's 11% of GDP. I'm really concerned about what happens in the Philippines as a result of COVID-19. I think the number of Filipinos who work in the cruise industry is around 120,000. And their remittances may be somewhere between 0.5% to 1% of GDP. And the cruise industry may not exist next year. So, but Indonesia doesn't have quite that kind of macro problem because the domestic economy in Indonesia is stronger. And so, longer term, I think you're going to continue to see Indonesians going overseas to work. I'm not sure that the macro problems are going to be as great in Indonesia, but it's certainly a concern given the conditions that many Indonesian workers work in on ships, cruise ships, but Kemlu's done a great job of trying to make sure that all of them are okay. And this is also an opportunity to really say that something that Jokowi was criticized for early in his administration, for redirecting the foreign ministry's attention from summit diplomacy to what he called diplomacy membumikan, down-to-earth diplomacy, and a focus on consular work for Indonesians overseas. This is one area where it's really paying dividends. Kemlu always did this, but Jokowi's instruction that they focus on it more clearly may have helped them weather this crisis for Indonesians overseas.
Mm-hmm.
So, Dr. Juwita, we have someone who's raised her hand. Adlina Abdul Rahim, please go ahead, please.
Hi, Adam. Okay, my question is that he's getting help from South Korea, many help in South Korea in addressing this COVID-19 issue. Could you comment on that? And what are the countries that maybe have some trade interest in Indonesia that you see will be helping out as well?
Yeah, I mean, again, South Korea's help to Indonesia with the testing kits and with the reagents and things like that has been absolutely invaluable. I think if you look at one country whose assistance to Indonesia has been most key to their ability to begin to step up the response to the virus, it's been South Korea. But you know, when it comes to foreign investment in Indonesia, although China is now the largest source of foreign investment flows in Indonesia, the stocks of investment from European countries, from the United States, from Japan, from mostly from Singapore, although some of that may be pass-through investment, is still much greater than China. And you know, whether or not those projects continue to, you know, whether or not those those countries continue to invest in projects in Indonesia will make a big difference as to how Indonesia is able to recover from the virus. And I just don't think we know yet, because some of these countries are also going to be in quite a bit of distress as well.
Right. I have two questions on Indonesia's food security and also Indonesia's preparation if there were to be a second wave of COVID-19. So on the food security situation in Indonesia, what are the challenges that you think Indonesia is facing in light of the COVID-19? And what can Indonesia learn from the current challenges to prepare for the second wave of COVID-19 if, God forbid, there would be one in the next couple of months?
Yeah, well, I think when it comes to the second wave of COVID-19, we have to get through the first wave. Indonesia is not through the first wave now. And the virus will continue to spread throughout the archipelago. So Jakarta has been hardest hit, and after Jakarta, the four major provinces of Java. Bali, the official statistics suggest that Bali hasn't been hit as hard as Java, but I think that's probably not right. And actually, the province that is right after the Javanese provinces is South Sulawesi, which is where there was a big Jemaah Tabligh event that the government refused to cancel in early March. And so that may have something to do with it. But the virus is going to continue to spread throughout the archipelago because Mudik effectively has already happened, and we may, continue to see hotspots pop up in different parts of Sumatra. West Sumatra appears to be sort of the next big hotspot in Sumatra, and they've put in pretty strict movement control orders. But Jambi reported a dengue epidemic earlier this month that may actually be related to COVID-19. So there's going to continue to be, the virus is going to continue to spread. And so we have to get through that wave first before we start thinking about the second wave. But hopefully the government learned something from the first wave and is able to more effectively combat it. The second question was on, can you remind me what the second question you pointed up was?
One is on food security,
right.
And the other one is on, sorry.
Yeah, sorry, it's just the food security one. I think I answered the question on second wave, but the food security one, this has actually been one of those areas where a problem for Indonesia might actually turn out to be helpful during a situation like this. Indonesia has relatively high food prices all the time because it is so protectionist and because the government is very concerned about food security issues. And as a result, it grows more expensive food at home in order to prevent food security issues. So if you look, for instance, at the food security crisis that occurred in 2007, Indonesia was less affected by that than other countries because its food prices were already relatively high. And so it didn't face the same problem that other countries had. So this is the exchange that Indonesia makes long term. It has less volatility in exchange for higher food prices. That has some very bad long-term consequences. For instance, child stunting in Indonesia is much worse than in neighboring countries. But as a result, it might actually have fewer food security problems than other countries during a crisis like this. So, pick your health crisis, right? You can have mass childhood stunting, or you can have food security during a pandemic. It's one of those sort of contradictions in Indonesia where it may actually come out ahead because of some of the counterproductive policies that it has adopted in the past.
Okay, thank you. Is there any more questions through the raise hand function so that you can ask Aaron directly? We have a shy group now, but let me throw you another question on social stigmatization. So based on how religion has been used to protect Indonesians in the past, has there been a backlash on religion, or there might be in the future in Indonesia? Will this affect Indonesia's social cohesion? So in Malaysia, the tabligh members following the Sri Petaling gatherings are already socially stigmatized. So we would like to know what is your take on Indonesia in this case?
I think the consequences of what has happened so far are still playing out. But what's really interesting about the role of religion in this crisis is that various actors played roles opposite to what you would have expected, and Johannes Lyman, I think, has convincingly argued that's because politics took precedence over religion. And so, for instance, Jokowi's slow response downplaying the outbreak of the virus led Islamist groups like PKS and some of these online preachers like Abdul Somad, who endorsed Prabowo in the last election, had led them to take a much harder line on the virus and to discourage Mudik much earlier and to call for lockdown measures. And really, I think the politics of this was that these were very successful tactics for embarrassing the president. And so the religious organizations, which he thought might have been more reluctant to order lockdown measures, were actually out in front arguing for them. And the Jokowi administration, which was supposed to be this more technocratic administration, more secular administration, perhaps more closer to the science, they didn't. And they're paying the price for that now. And ultimately, they've had to adopt the policies that Anies Baswedan and the PKS, for instance, were arguing for them to adopt weeks ago. But I don't think that that's because there was any particular source of wisdom from those who are arguing, religious wisdom, from those who are arguing for lockdown measures earlier on. It was really the politics of this that took precedence over religion. And in some ways, Jokowi and Johannes has made this argument convincingly. He was reluctant to adopt measures that scientists were arguing for because these religious organizations were arguing for them before he did. So it's just, I think, an interesting example of the way that we often think that Indonesian politics is sort of the defining features of Indonesian politics emerge from views on religion. But actually, I think a lot of these things are politics first and then religion second.
Right, thank you. So we have come to the end of the webinar. I would like to thank Mr. Aaron Connelly for spending his afternoon today. Thank you so much for your insightful presentation and also your on-point reflection towards the comments and also the questions. So thank you everyone for being here, and we look forward to having you all again in our next webinars coming soon. We will let you know, and your support is very much appreciated at this time. Thank you so much. And thanks
for making this first webinar really enjoyable and really informative.
It is my pleasure, my honor. Thanks very much.
Thank you.